Presence regulates a baby's nervous system. A newborn baby enters the world with a nervous system that is still developing. Babies cannot fully regulate stress, breathing, or emotional responses on their own. Because of this, they rely on something psychologists call co-regulation. Co-regulation means a baby uses the presence of a caregiver to stabilize their body. When a baby sleeps near a parent, their body begins to respond to signals from that parent. They hear breathing, they feel warmth, they sense small movements. These signals help the baby's brain understand that the environment is safe. Researchers studying infant sleep have found that babies sleeping near caregivers often show more stable breathing patterns and lower stress responses. Your body becomes a kind of biological reference point. When a caregiver is nearby, the brain receives clear signals of safety. But when a baby is placed completely alone, the brain may move into a mild alert state. That alert state is why many babies wake faster or cry soon after being placed down. Babies are wired to stay close at night. Babies are born with instincts shaped by thousands of years of human history. For most of that history, babies slept very close to their caregivers. In many traditional cultures around the world, infants still sleep near their parents during the early months. From an evolutionary perspective, this closeness made sense. A baby separated from caregivers in ancient environments would have faced serious risks: cold temperatures, danger, or simply the inability to signal distress. Because of this, the infant brain developed a simple survival rule: stay close to caregivers. This instinct is especially strong during the night. When a baby wakes and senses a caregiver nearby, the brain quickly relaxes. But when the baby wakes and senses isolation, the brain can activate a mild alarm response. Crying becomes a signal designed to restore closeness. This response is not manipulation. It is simply biology. The baby's brain is following the survival program it was built with. That is why many babies settle faster when they know a parent is nearby. When that safety signal is present, the body can relax and sleep becomes easier. Babies sleep more calmly when they sense you. Babies move through sleep cycles just like adults do. But in early infancy, those cycles are much shorter. A baby may shift between sleep stages every 40 to 50 minutes. During these transitions, babies briefly wake. When a parent is nearby, the baby senses familiar signals: breathing, movement, warmth. These signals reassure the brain that everything is safe. Because of that reassurance, the baby often drifts back into sleep quickly. But when those signals are missing, the brain may interpret the situation as uncertain. That uncertainty can cause the baby to wake fully and begin crying. In many cases, the baby is not hungry or uncomfortable. They simply need confirmation that their caregiver is still nearby. Once that signal is restored through presence, touch, or voice, the baby can relax again. This is one reason many babies sleep more peacefully when they share a room with their parents.